Hi, I'm Dr. Nick Mast. Thanks so much for watching this video. If you're watching this video, it means you're getting ready for surgery, and I know that's a daunting task. I appreciate you taking the time it takes to make sure you're ready, to get prepared and informed about your upcoming procedure. And that's what we're going to do here today. So if you're catching this video, you've probably already scheduled with our scheduling team. Hopefully you've selected your location of care. And if it's at the hospital, generally the hospital has its own preoperative nursing that will call you. It's called pre-admission testing, and they're going to make sure that you're ready for surgery. If you're at the hospital, generally it means that you've got other medical reasons that would require monitoring and or a need for an overnight stay. Typically, the hospital has a 23-hour requirement, meaning if you're having surgery there, that we're typically anticipating a potential 23-hour stay. If you're alternatively in the surgery center, which is a ambulatory care setting, it's typically done in a way that you can go home that evening. We find that patients have a better overall experience. They're able to sleep better in their own beds and actually have a easier recovery if it's done in that ambulatory setting. Medications that are never appropriate around the time of surgery are blood thinners. Typically, we do our surgeries under a spinal anesthetic where needles inserted near the spinal cord. We want to make sure that there's no blood thinners involved anywhere within 72 hours prior to that procedure. Typical blood thinners that people don't expect are over-the-counter non-steroidal anti-inflammatory medications. These are things like ibuprofen, Aleve, naproxen, aspirin. All of these medications do carry with them a slight risk of bleeding. A safe alternative to these medications, if you are having pain within 2 weeks of surgery, is Tylenol. Acetaminophen, or Tylenol, is generally a very safe medication to take up to and around the time of surgery. Non-steroidal anti-inflammatory medications are typically stopped 7 to 10 days prior to surgery. The reason why is they affect platelet function, and it takes about 7 to 10 days for your platelet function to return to normal. So you really want to make sure that you stop these with enough time so that your platelets work normally. An important person to have in your care team is a coach or a friend, a family member, somebody who can give you a ride to and from the center. You're not able to drive yourself at the end of the procedure. You're certainly not able to take a ride share home. So make sure you have an appropriate person to pick you up. As you get within about 3 days, you want to start to optimize for surgery. Optimizing for surgery means getting your physiologic state ready for the trauma of surgery. It's like getting adequate rest, adequate sleep, staying on a normal sleep cycle, getting adequate hydration, making sure you're taking plenty of fluids. Coming in well hydrated is much better in terms of blood loss. Good nutrition is important. Things like proteins, amino acids, these are the building blocks for wound healing. These are important for you to take as you get close to surgery. If you're interested in supplements, we can guide you in terms of what supplements are very helpful around the time of surgery, and these are things that you can find both at your health food store or through our clinic ourselves. Things have actually changed in the anesthesia world, and we found that people who have clear liquids as they come in within about 4 hours prior to the procedure actually do better. So one of the strategies we have come up with here is we want you to start to drink clear liquids the day before surgery so you're well hydrated. So clear liquids include water, coffee with no cream, tea with no cream. We want you to drink fruit juice or Gatorade. Now stay away from the protein shakes, stay away from the kale blended fruit drinks and the orange juice. All of these things have pulp, so by definition, a clear liquid is something that you could hold up and read a book through. The last thing we need to talk about is how to reduce the risk of infection. Any prosthetic joint, if infected, it can be real difficult to manage. So one of the strategies we have is to reduce the bacterial colonization of the skin. Typically, we use an antibacterial soap for a couple of days prior to the procedure. The most common one we prescribe, which is available over the counter, is called HibaCleanse. So you'll do your normal shampoo, you'll do your normal routine. At the end, you'll get a fresh washcloth. We want to repeat this process a couple of times before surgery. In my practice, that's typically the night before and the morning of. So it's 2 showers, one the night before, one the morning of, where you're going to be using this technique to decolonize the skin. So the day of surgery's finally come. So what are you going to wear? Well, typically you need loose clothing that is easily put on. These would be things with like elastic waistbands, zippers, where you can easily get them on and off. These would be things that you could wear to the center. Remember, you're gonna be spending all day with us, and we want you to be comfortable. We want shoes that you feel comfortable walking in, and it's something with good grip, because we're gonna be working with you on learning to walk with your new hip, how to climb stairs, and how to make that transition home. So these are important things to think about as you select your clothing for the day of surgery. So we've talked about all the things you definitely want to do as you get ready for surgery. So these are the do's. There are some definite don'ts, and the most important one for me to impress upon you is nicotine. Well, I just want you to know that nicotine itself is a very potent wound inhibitor. It really inhibits healing, and it's because it's a vasoconstrictor. It basically prevents nutrients and blood flow getting to the surgical wound. For cigarettes, this is typically 4 weeks prior to your procedure. For any other nicotine product, typically within 2 weeks. So you really want to make sure you disclose this to us, let us know, so that we can put an effective plan in place to get you off the nicotine. So another medication you have to disclose to us is any preoperative pain medications, specifically opioid medications. Now, there are other medications like gabapentin or Lyrica, that these are also important for us to know, but the opioids in particular are very challenging around the time of surgery. One of the biggest problems that we have in surgery is making sure people have adequate pain control afterwards. And adequate pain control is inhibited if you're taking opioid medications pre-surgery. Because what happens is there's the mu opioid receptor. These are receptors on your pain cells that basically get upregulated in response to taking opioids. So what we find is we need higher doses after surgery to control pain. And sometimes these are higher than we can actually utilize safely. And so we end up in real challenges with pain management after surgery. So the best way to make sure that you have good pain control after surgery is to be on the lowest effective dose, or even off of these medications, for at least a week or 2 before undergoing surgery. An important medication for us to talk about right now is the GLP-1 inhibitors. These are things like semaglutide, Ozempic. You've heard of these, and if you're placed on one of these medications, it's very important for you to let us know. This is probably the most controversial topic that we will cover with this pre-op. And this has to do with dental work. And it's because for generations of surgeons, it was considered a lifetime sentence. If you had a prosthetic joint, you needed to be on antibiotics anytime you had your teeth worked on. And the data on this is starting to show that really that strategy has not been very effective at eliminating the complications from dental work. And not only that, there are side effects from antibiotic usage, especially if you're taking a lot of them over the course of your life. We know that antibiotic therapy is not always the best thing. So in coming to agreement with the American Dental Association, the American Academy of Orthopedic Surgeons put out a guideline. And this guideline is an ADA/AAOS guideline. And certainly you can find that if you Google it, or we'll try to provide a link here. But basically, these AAOS guidelines mean that basically, if you've got a good immune system, you really don't need antibiotic prophylaxis for dental work. Now, physical therapy, there's a couple different strategies here. There's actually some studies showing that if you do therapy or if you don't, at a year, it doesn't really make a difference. You're still going to get a good outcome. You're still going to do well from the standpoint of the procedure. So typically, the surgery happens, and for the first 2 weeks, there's actually a therapist that comes to your home. We call this home health PT, where the therapist is actually working in the home environment to make sure you're safe. The goal of this therapy is not to get your range of motion or your strength. It's really just to make sure that you're safe when you get home. If you're doing well at home, feel free to wave these therapists off. You can let them know that you're doing well, and it's really not that important that you get therapy in the home environment. However, if you do want to do physical therapy, we do encourage you to start it around 2 weeks. Once the swelling around the hip has subsided, it is appropriate to start working on range of motion, strength, flexibility, and gait training. All of these can be facilitated by an outpatient physical therapist. I'd encourage you to research and find a physical therapist close to your home where it's convenient, where you can go a couple times a week. There's no magic therapy here. It's not some, specialist in therapy. It's basics. It's basics about range of motion, strength, and walking. You can start this at 2 weeks, and we'd encourage people to maintain that relationship for a few months. You'll probably find you'll benefit. So you made it through surgery at this point, and there's going to be some management that we're going to talk about for after surgery, and specifically we're going to talk about the medications that we use after surgery. The medications we use are dictated by the typical challenges that we see after surgery. The first one obviously is pain management. You just had surgery. I expect you to have a little bit of pain. We do a really good job of controlling that, but we're going to give you some medications to help with this in the home setting. A first line agent would be something like Tylenol. Tylenol is very safe to take around the time of surgery. It's safe to take before surgery. So if the Tylenol doesn't work, then we go to the next line of treatment, and the next line of treatment here is an opioid medication. Now we will prescribe these for you. Now these are Tramadol, Norco, which is also known as hydrocodone, or Percocet, which is also known as oxycodone. Now remember, some of these medications have Tylenol in them as well, so you want to factor those into the calculation of how much Tylenol you get in 24 hours. Remember, we don't want to go over 4,000 milligrams in 24 hours. So please read the label of which medication you're on. Typically, these are medications that have some Tylenol in them. Another important thing to remember is these medications have side effects. If you've had problems with any one of these medications in the past, please let us know. That way we can avoid prescribing you a medication that we know you have a sensitivity to. But just remember, itching, nausea, constipation, these are all side effects of all of the opioid medications, and they increase with the increasing potency. So if you're taking Tramadol, you're less likely to get it than you are with Percocet, which is much stronger. So our goal is to get you the best pain control we can with the minimum amount of side effects. So in addition to the pain medication, which we will be prescribing, we're also going to be prescribing an anti-inflammatory. So typically we prescribe something like Celebrex, meloxicam, ibuprofen, or Aleve, one of these medications. Now, the details for your particular case will be worked out with you with our preoperative team. This is an important medication not to forego in your early recovery. So the next medication we're going to talk about is stool softeners. It's important to take these after surgery. Not uncommon to get constipated after surgery, even if you're not taking any narcotics. You just received a big whopping dose at the time of surgery. That's going to slow anybody's gut down. And what happens when your gut starts slowing down, more water comes out of your gut. And the problem with that is it makes stool very hard. So you really want to make sure that you're taking these after surgery. If you're quite sensitive to constipation, meaning it's more of a common than not, you may even consider starting these the day before or even a couple nights before your surgery. The last medication that we typically prescribe is a blood thinner. Now, this varies from person to person. If you're on pre-existing blood thinners, we typically just resume those. So these would be things like Xarelto, Eliquis, Coumadin. If you're on any of these medications, please, again, let us know so that we can make adjustments accordingly. But if you're not on any of these medications and you have no prior risk of blood clot, you're actually in a low risk category. And for these people, we typically just use a baby aspirin. So it's 81 milligrams, so it's a little chewable baby aspirin. We take it twice a day, once in the morning, once at night. We found that it reduces platelet function just enough to reduce that risk of blood clot without making you too thin and risking the wound starting to drain or have problems. An important thing that we need to talk about after surgery is swelling. This is important to talk about because you're going to notice this after surgery. And everybody thinks it's the day after surgery. And interestingly, we see it about 5 days after surgery. So if your surgery is on a Monday, you won't even see it till the weekend. Now, typically, it doesn't represent something more problematic. But if swelling goes below the knee, we can sometimes be concerned and would recommend for those cases for you to go get a duplex ultrasound, which is to rule out a presence of a blood clot. So an important part of our postoperative care is icing. You've probably heard the old statement, RICE, right? Rest, ice, compression, elevation. So we want to get adequate rest. So for the first 2 weeks, using a walker, resting that hip, sitting, relaxing, letting things heal. That's important. Ice is an important part of this. You want to do it as much as you can put up with. So for the first couple of days after surgery, getting up and making it to the freezer to go get one of those gel pads and putting it on. It's important to do that and keep it just cycling, throughout the course of the day. To improve the compliance with this, we've actually included in our protocol the use of an ice machine. I recognize it's an extra expense for a lot of people because insurances don't seem to cover it, but an ice machine can be really helpful because it makes it more likely that you're going to do it. You basically put it on, you turn it on, and you can go for 2 hours without having to get back up to the freezer. It'll provide some compression, it'll provide some cooling, and these things are really helpful in that early recovery. So there's a lot of things that are worrisome after surgery. And there are some things that are worrisome that aren't problems, and there are some things that are worrisome that are. And so it's kind of important to get a little basis on this. It's not uncommon to get a low-grade temp for the first week, and this typically doesn't represent infection. This is, in the old days, we'd call it atelectasis. It means that you've got a little bit of extra mucus or fluid in the lungs that your body's just trying to clear, and that causes some inflammation. So deep breathing exercises are encouraged for that. But it's not uncommon to get a low-grade temp, and by low-grade I mean under 101. This is pretty typical for the first week. Now, if it happens after the first week, these are really important for us to know because it could be the sign of an early infection. And certainly if you're seeing other things like redness around the incision, drainage from the incision, burning with urination, a cough that's just not going away, these would be reasons to let us know, hey, I've got both a fever and these other symptoms. Those are important to know. Typically after the surgery, we have sealed the wound. We do a nice closure. We're typically using a running monocrystal suture. So we're using absorbable sutures that basically your body absorbs. We also cover this with a special wound dressing to allow you to shower immediately. That wound should stay dry. I mean, it is sealed shut. So if you are noticing drainage from the incision, that is important to let us know. Now, if it's the first 24 hours and you got a couple little spots, that's usually not a problem. But if it's something where you've seen, active drainage, even if it's clear, it's important to let us know. Swelling can be a problem, and swelling that can go below the knee can lead to problems with incompetent veins. These are unsightly things like varicose veins and other things that you've seen. The way to reduce this risk is to wear a light compression stocking. Now, the hospital does provide the TED hose, and these are very effective at that. But there are other compression stockings that can do the same job. The main thing is that if you're using these, you want to see the presence of swelling, or if you are seeing the presence of swelling, you should be using these. A big question that I have is how active should I be after surgery? So a good strategy is if you've got a Fitbit or an Apple Watch, something where you can keep track of your steps. We really don't want over 1,500 steps in a 24-hour period for the first 2 weeks. Another way of thinking about it is we want you to do little 5-minute walks about once an hour. So while you're awake, getting up, going to the bathroom, getting up, going to the kitchen to make yourself a sandwich, those are little 5-minute walks. So if you're doing one of those an hour, you're doing about right. That's really all we want you doing. We want you to get up, go do these things, get back to the couch, get back to icing. So common questions I have are, when can I return to work? It depends a little bit about what you do. Now, for manual laborers, we really do want you staying off of work for a minimum of 6 weeks. And it's just because, climbing up ladders, jumping in and out of trucks, you're going to put undue stress upon the implant, and we really don't want to do that. So a minimum of 6 weeks for those kind of work and those kind of activities. For desk work, people that spend a lot of time on working remote or other things, you can go back as soon as you feel comfortable doing so. But I am going to counsel you, please respect your body's need for rest. A minimum of 2 weeks is an appropriate amount of time to tell your employer, hey, I'm going to be out. I'm going to be attending to getting better. Another question I commonly get is, when can I return to driving? Our strategy here is when you're walking normally, off assisted devices, and able to get a panic stop done, then it's appropriate for you to be returned to driving. And we see that around 3 to 4 weeks. So it is appropriate to wait 3 to 4 weeks before returning to driving. Well, if you've made it this far, I applaud you, because you're taking the first steps to make sure you have the best recovery possible. I want you to know that I've invested heavily in a care team that's going to support you throughout this process. I'm proud of them. They do a great job. So if there's additional quick concerns, get them down on paper, bring them to your next appointment with us, or just give us a call. You know the number. It's on our website right here. You can get in touch with us to let us know. From all of us here at the Hip and Pelvis Institute, we're looking forward to a great recovery for you, and just know we're here for you every step of the way.